This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to another edition of Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And what we talk about here on the show is we talk about the who, what, when, where, why, and how of Innovative Medical Associates, how it can help you and anyone you know improve your overall quality of life. And we'll give you plenty of examples here today on the show. And we do encourage your participation. If you have a question for Dr. Molly or a medical challenge you want to run by her, call 855-839-1210. That's our number here in the studio, 855-839-1210. Again, it's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. And it's I always like to say it's a good day to get healthy.
It is, John, and I'm glad to be live again today. We've really had a couple weeks off, and then we're back, and last week and now, and people have said they enjoyed the fact that we're back together, and I do too, John.
Yes. Let's get started with what is Innovative Medical Associates all about? What is it? What sets it apart from others? Every
week we start with this, and every week we still get questions, right?
Yes.
So let's start with that. What integrative medicine is actually, or medical associates, is actually a group of like-minded healthcare providers who operate out of my licensed facility in Marlton, New Jersey. And we are technically a primary care facility, which means we can do everything that a primary care doctor can do. And I like to reckon that back to the old days, like when we were kids and we went to our GP and he had the black bag and he would go in there and let you leave with something if you had a complaint. We like to do the same thing. So if you need radiology, meaning you need x-rays or CTs or scans, we can order those. If you need medication, it can be done. If you need physical therapy, we can send you out for it. If you need, if you need occupational therapy this week, we had to send somebody for it. So there's nothing we can't do that a regular facility can do. With that being said, though, it's our philosophy that actually separates us from other primary care facilities, because we believe that we'd like to augment all of pharmaceuticals, if needed and medically warranted, with natural substances in order to reduce the side effects of the pharmaceuticals.
Remember when the doctor came to your house?
Oh, heck yes. Yeah, yes, I do remember that. And it's true.
Long gone.
Right. And he gave you a little envelope, and you could go, well, you can still leave my office with a little envelope if you need it. However, what's happening today is we'd like to really reduce the side effects that pharmaceuticals can cause a patient. And what we want to do is help them effectuate the change for their particular problem by augmenting with these natural substances. And our delivery system is a little unique because we believe in hydration for the delivery.
And everything is done through hydration.
Right. At our facility, just about everything is done through hydration if the patient can be cleared for hydration, obviously.
And what is the ingredients? And again, it's all different.
Sure,
some of the things that you use.
Sure, we use vitamins, we use minerals, we use amino acids, we use constituents. We use constituents in our IVs that are extracted from natural sources because, again, we believe that the natural products can absolutely help a patient and reduce the need for certain medications. In particular, we've seen this for 28 years in October. 28 years we're there in October.
That's
and you remember, I've been with you probably 20 of those 28 years.
Right.
And I would say that we're able successfully to reduce people's medication needs by utilizing these natural substances and in an appropriate manner. So, for example, how many patients have we helped over the years with cholesterol problems? Too numerous to count, actually, John, assuming that the patient also does their share. And again, in primary care, there's an element of counseling that has to be done with the patient and say, hey, listen, you've got to eliminate some of the things that could contribute to the cholesterol, but these particular products will help you reduce your cholesterol and maybe reduce the side effects of statins and even some of the newer drugs that are out that are injectable. My goodness, there's a lot of it, John.
The question always comes up.
I know it before you say it.
Does this work? Do natural products work? Because we're conditioned that, drugs are the thing to do.
Yeah.
But does this work?
It does. It does work. And it does work. And again, I'm going to say this. Look, nothing works in a vacuum, John. You've got to utilize the natural substance appropriately. We've got to make sure that patients understand that there can be side effects from natural substances. That's the other thing. You know, if you have an allergy or something, we need to know that so we can eliminate some of those particular natural substances. But again, John, it's like everything else. It may take time. But you know what's the fascinating thing? When people follow our program, generally they start to see improvement in as little as 5 weeks, which is pretty quick, assuming they follow the program and they come in once or twice a week, depending on the severity of their condition and when they come in to see us.
I had a patient, one of your patients said to me the other day, how long have you been coming here?
Oh, yeah, they love that.
And
they love to torture you with that.
I said, over 20 years. And he looked at me. He said, "Are you getting better?" And I said, "Yeah, but I have so many challenges.
Well,
they're attacking one at a time."
But here's the deal. Here's the deal, John. You're not unique. You know how many people come with a multitude of challenges? Like, which challenge really started the process of giving you the problems? Well, you know what? Sometimes this goes back to when we were in our 30s.
Yes.
Right? Bad living, right? Smoking. How many times have I seen a patient come in and say, well, you know, I gave it up 10 years ago. Well, guess what? You might have given it up 10 years ago, but the damage might have been done.
That's right.
And we've seen that. I have a patient right now who absolutely comes in on oxygen and he goes, well, I gave this up 15 years ago. Did you? Well, you obviously you did damage to your lungs somewhere along the line.
So it's a series of, and I think people don't understand that.
Right.
It's a series of challenges that you're attacking one
at a time. And again, we have to decide which are the most serious that we have to get to in order to make sure that the quality of life for that patient is improved. And that really is the focus of our entire practice. We want to improve your quality of life while no matter what your challenge is or what got you to this. So that in and of itself takes a little thinking.
How many treatments would you expect when you start out?
Yeah.
How many treatments would you expect to receive?
Well, I say this. The problem is people think it's a one and done. You know, people think that about their pharmaceuticals too.
Yes.
One and done.
Yes.
That's it. No, it doesn't work like that. The body, God's made this body in a complex organism, you know. As I tell people, we talked about cellular communication last week. Can you imagine how complex this is? So really, what it can take is anywhere from 5 to 10 weeks in order to start to see the improvement. And that's going to depend on where you are in your particular problem cycle. I mean, you come in and you have stage 4 cancer. Do you really think 2 treatments is going to make you feel better?
Absolutely
I don't think
not,
so.
no.
Okay, and that's why in our facility, we're not one to say, hey, come in and get a quick trip. That's what separates us from these places that are doing, you know, you have a headache, come in. You feel you don't feel good, you drank too much last night, come in. Nah, that isn't what we do. We want to effectuate quality of life in people who have conditions that have really impeded their ability to have a good quality.
We are coming up on our first break of the morning. The show is called Health Watch, and it is here every Sunday, 8 till 9, here on Talk Radio 1210 WPH.D. I'm your host, John DeMasi, with Dr. Molly Fantasia, the Ph.D. doctor, the founder of Innovative Medical Associates, and, of course, the executive director of Innovative Medical Associates, located in Marlton, New Jersey. If you have a question for Dr. Molly, or a medical challenge you want to run by her. 855-839-1210. And we always tell you at this point of the show, you can call now because we have plenty of time to take your call, and Dr. Molly can spend some time with you here on the radio. 855-839-1210 is our number here in the studio. Again, Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And I'm your host, John DeMasi. We are coming back. Dr. Molly and I return with more of today's Health Watch after these words. We are back here on Health Watch. Operators are standing by right now at Innovative Medical Associates, and the number 856-489-0505. Now, you're probably wondering, why do we give out that number here on the show? Well, it's simple. You want to call right now and schedule the initial consultation with Dr. Molly. It is complimentary, and really you will find a lot about what she does and how she can potentially help you and anyone you know improve your quality of life. It's very simple. Call and make the appointment, 856-489-0505. That's the number, 856-489-0505. That is the number for Innovative Medical Associates, located in Marlton, New Jersey. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. A lot of good information on that as well. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. And we're ready to talk to you at 855-839-1210. That's our number here in the studio. We talk a lot about natural products, and that's what we're going to focus on right now, Dr. Molly. And really, that's the cornerstone of everything you do.
Exactly, John. You know, it's an interesting thing. I've been doing this for 28 years. And it's interesting because natural products have been the bedrock of drug discovery for many decades. It's going back to the 1950s. In fact, NCI has a laboratory in Maryland that goes back many years, and is particularly lately got a little bit of action going on. But part of the problem about natural products is that natural products are a crude extract, which means you hear me talk about constituents of a particular product. Well, that's the crude extract. And unfortunately, today, in today's highly technical kind of, environment, what's happened is that the natural products have taken a back seat for many of the drug companies because they want a quicker way to production. And the way to do that is not to actually go back and look at these crude constituents, but actually to formulate these in the lab. And obviously, that's a quicker return on their investment. R&D is very expensive. So what I'm saying, natural products have been a bedrock of drug discovery for many decades. We know about penicillin. Everybody knows it came from mold, right? I bet you people didn't know that one of the commonly used drugs for cancer, Taxol, has been around, and it actually has been around many years, and it was originally derived from the bark of a particular tree that called Pacific yew tree. I hope I'm pronouncing that right. It's Y-E-W. One of the first discoveries that particular constituents would work on cancer cells, actually slow down the progress of cancer cells. Now, I'm not saying Dr. Molly cures cancer. Let's get that straight. We have a cancer supportive program, but we know that natural products have the ability. And if you listened to me a little carefully last week, I talked about having the biological effect on certain cellular membranes. And that's really one of the things I want to talk about. Do you know, in the United States, I was able to look up 178 citations that talked about natural products as anti-cancerous. Do you believe that?
Wow, that is incredible.
It's amazing, isn't it?
Yeah.
And I can tell people, and this again is from NCI, which is actually the National Center, the National Cancer Institute, and it's some kind of relationship with our Department of Health and Human Services. I don't really understand all the politics of that, and I don't know, but I do know that it's something that's funded by the feds. So we have the data, and believe it or not, that's just data that I could see from the United States. If we go to the European data, I'm sure there's much more than that. So we're looking at a sizable amount of nutraceuticals that have an effect of some kind on rogue cells.
What kinds of, I know you use a lot of different things.
Yes.
But what kinds of products, like what are the main ones that you use?
Well, you know what? It's very interesting. You're talking about the main ones we use. Well, I started to cross-reference some of the stuff we use to, again, some of these 178 citations. So, for example, green tea extract has an ability to help people in cancer, and actually has an anti-tumor ability. DIM, people all know about DIM. Another thing, you look at extracts from black pepper. There is an extract that can help again. It can help people through their cancer journey. I am not saying that any of this is the cure for a particular cancer. I'm not saying that. I'm saying utilizing these could help people through their chemotherapy, their radiation therapy, whatever their immunotherapies. And if you use them properly, and you remember last week I said I looked at a particular immunotherapy and I took one of the particular extracts out of my protocol for that patient because it could have a negative effect. So we always have to be aware of that. But things like mistletoe's been around for years. And people say, oh, well, mistletoe here in this country, not a good thing. But actually in Europe, they're using it quite extensively, particularly in Germany. Also, we have to look at things like vinpocetine. And believe it or not, John, I just saw so much data on mushrooms, folks, turkey tail mushrooms, reishi mushrooms, various other combinations of mushrooms. And these are legitimate studies that I'm looking at that say in a clinical setting, they were using this, they're doing like studies, they used this and saw a change in cancer markers. Well, that's a big deal.
So you're talking about mushrooms, but don't go out and buy mushrooms.
Oh,
and
no.
cook them.
No. And this is where we go again,
Yeah.
you and me. John, we talk about this. Just don't walk into the health food store and say, give me 4 of these mushrooms, give me 2 of these. No.
That
In fact,
doesn't work that way.
Listen, that's the bane of my existence. Last week, I actually have a wonderful family whose mom we're treating for breast cancer. Very lovely lady. She's been with us before. She's had other people in the family that we've treated and done well with. Interestingly enough, the daughters have done this research. They're coming in with bagfuls of nutraceuticals, and I went through this with them while mom's in our particular treatment protocol and also doing a conventional chemotherapeutic. I said, listen, you got to take this one out, this one. She goes, well, this is all on the list of what I said, yes, but it could interfere with your chemo. So this is what I'm saying. So just because you come in and sit in my chair doesn't mean I forget about you.
Yes. So you're always tweaking the
protocols. This
Yeah.
is the deal. It's not a one-size protocol, and particularly for my cancer-supported patients. And that's true for all of my even chronic condition protocols. We do not rest and say one treatment plan for everyone. We just don't do it. But very important with our cancer and chronic conditions like fibromyalgia. The other thing is I'm looking more and more at these particular extracts, and again, going back to the citations and seeing how these some particular extracts work on viruses. I was like, I'm blown away. So I've been doing this for 20 years and doing just this kind of thing, looking at the citations, looking at other places that are doing work in natural substances and saying, hey, how does this mimic what's going on in the conventional world?
So you're always tweaking the protocols, and you're always tweaking how you think about it.
Every day, John. I think I live, eat, and breathe this. Somebody told me, are you ever going to just stop and watch some TV? I said, I don't have time. And it's a fact. It's really a fact.
We are coming up on the halfway point of the show, and our program is called Health Watch. It's here every Sunday from 8 till 9, the live version right here on Talk Radio 1210 WPH.D. I'm your host, John DeMasi, with Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We have some open lines, so if you want to call in right now, it's a good time to do it. 855-839-1210. That's our number here in the studio, 855-839-1210. The show is Health Watch, and Dr. Molly and I will return with more of today's edition of Health Watch right after these words. We are back here on Health Watch, and as always, operators standing by right now at Innovative Medical Associates. And the number, 856-489-0505. 856-489-0505. When you call, simple. All you want to do is make the appointment for the initial consultation with Dr. Molly, and you will learn a lot about what she can do and how she can help you potentially, and really how you can move forward with your life, because that's what you want to do. 856-489-0505, and the website, innovativemedicalassociates.com. innovativemedicalassociates.com. That's the website. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We're going to go to the phones right now and talk to our favorite caller, Frank in the Northeast. Frank,
Hey,
good morning. You're on Health Watch with Dr. Molly.
Hey, Frank, how are you?
Hello?
Hi, Frank.
Hi. We lost... I'm here now. I lost you. Dr. Molly, I'm talking about myself. Excuse me. Food sensitivities.
Yes.
I have a ton of them.
Yeah.
Pretty much name of food, that's one of them, okay?
Sure.
Does that cause inflammation?
Oh yes, oh yes, oh yes. Of course, Frank. And it can, and in particular, when you combine certain foods. In other words, you have, let's say, you have inflammation to apples, but you also have it to cinnamon. Don't you think altogether that's going to give you a worse reaction? Even though they're not saying you're allergic to it, but don't you think you would have some discomfort and some inflammation throughout your body? Yeah,
well,
of course.
Before Dr. Molly, I've been noticing just my abdomen, my neck and face. But more recently, it's my whole body, my hands, my pelvis, my legs. I mean,
sure.
Does it also cause inflammation in your veins and arteries or organs?
Yeah, of course. It can.
Really?
You know, here's the real thing. I think what we're finding is your white blood cells. I mean, they're your army, so they're going after these. In particular, if you're eating more than one thing that you have an inflammatory response to, it's very, very important to keep those lymphatics draining. Frank, for you, that I would say is absolutely paramount. And even from what I know of your case, that I'm thinking off the top of my head, your lymphatic system, you've got to keep that going, because that's that's going to keep you in a state of homeostasis to the best of our ability.
And Dr. Mott, just to let you know, my lymph nodes, my neck, and my arms, they're enlarged. They've been enlarged for at least 20 years.
Why do you think they're that's a problem? Because they're moving. Our lymphs keep us clean. I like to call it like our filter, right? So of course you need to keep those going. And I think I sent to you, or I gave you something that we use, a homeopathic, to help in that. Frank, make sure if you call the office and you speak to Fran, I'll have her put one in the mail to you. Okay? Because you need
Dr. Molly.
that. Yeah.
Let me say one thing, please. To people listening, I'm issuing a baby challenge. A first-time caller, today, call in. You've been thinking about calling Dr. Molly for quite some time. Don't be shy. She's friendly. She's nice. Call in. You've been thinking about it for a long time. Call in. First-time caller challenge.
Thank you. Thanks for the plug, Frank.
You're the best. Call the office, Frank. I'll get something to you. Okay.
Thanks.
God bless you.
Thanks for the call.
Bye-bye.
We have Cindy in Audubon, New Jersey. Hi. Cindy, good morning. You're on Health Watch with Dr. Molly.
Hi, Cindy.
Good morning. Hi, Dr. Molly and Frank. I'm a first-time caller, so there you go. Bada bing, got your first-time caller.
Hey.
Dr. Molly, I have a very serious problem. My mom is 86 years old.
God bless her.
She has a pacemaker, and when we went to the hospital to have the pacemaker implanted, she suffered from severe neck pain. It's all on the left side. We've been to every doctor imaginable. No help whatsoever. She obviously has some heart problems. She's had a valve replacement. The problem is, how would you be able to help her with this pain? We can't figure out, is it nerve? Is it muscular? She's had the injections in her neck. Tried a nerve block. That didn't work.
Can I ask you, Cindy, can I ask you a couple questions if you don't mind?
Yes.
The nerve block, did you have that from a pain management guy? I mean,
yes.
Okay, good.
At a reputable hospital.
Good. Go ahead. Now tell me about what else? Go ahead.
That's the main thing. It's actually hindering her walking now because she leans to the right side because she can't put her neck straight because of the pain. And it's constant. It never goes away. She's on Tylenol 24/7.
Oh, man, that's bad,
It's horrible.
I'll tell you what I would do, okay? I want you to come in for the free consult, and I want you to do that consult with myself and with Dr. Cassica, Pat Cassica, who's my medical director, one of them. And the reason being is she spent 20 years doing anesthesia, right? I want to get a little more information about the nerve block, but I can tell you this. I can certainly eliminate some of the pain with some of the homeopathics we use, certainly for short term, but I can't say we eliminate it ongoing. But I would like to help because what I would want to do is try to get a handle on, is this coming from anywhere else rather than just the nerve, endings? Are we looking at some other phenomena? So, yeah, I would love you to come in. I probably can't do that this week, Cindy, but I bet you we can get you in next Tuesday. I'm thinking off the top of my head. And I would love for you to come and sit with Pat and I. I think we'd be able to help solve this problem for your mother, at least give her some relief.
That's all she's asking for, doctor, because her quality of life has not been very good. And in other ways, she's fine mentally and all.
God bless her.
And we also think she has neuropathy because of the tingling.
Yes.
And so I don't know. I'm throwing all these. She's 86, obviously, so there's a lot of things going on. So I don't know if you treat people with all these multiple conditions.
Listen, the neuropathy, I know we can help you with our homeopathics and some other things. Absolutely, unequivocally. And so in that case, I think I could get you in this week to sit with me and possibly my other doc. But what I would really like to say is come in for the free consult. Let's talk about this. See if we can give Mom some relief and help her also. Did she use any topicals? Do you know if they put any topicals on her? They did. Do you know what they did?
Yeah.
What did they use? Do you know, Cindy?
You mean like over-the-counter topicals?
No, like something prescription. Anything? You don't know?
Oh, no. Well, we've tried pregabalin.
Yeah. Okay. Good.
That's not a topical, but we've tried that, and that really hasn't done very much for her at all.
Okay.
The topicals we've put on her were over the counter, and she's got a history of AFib. So if we put too much on,
do it.
she goes into AFib.
Exactly. I got it. I really do. Your mom's got a little bit of a complex case, but I think we can help her. Come in and see me. I'll tell you, I have something I would want to use from you that I get in, a topical that I get in from Italy. Unbelievable success with the neuropathy. Come and see me.
Yes, schedule that. Call that the operator's number and schedule that.
God bless you, Cindy.
Thank
and
you
God
for the
bless
call.
your
Thank
mom.
you.
God bless your mom.
Thank you
so
for the
much.
call.
Thank you. Okay.
Bye.
855-839-1210. That's our number here in the studio. If you want to call in with a question or a medical challenge you want to run by Dr. Molly. And I was thinking, if you can help her, well, I have multiple challenges, and you're helping me. So
you're a little younger.
Yeah, slightly, but
okay.
Yes.
You're a little younger, John. But it's interesting because of what she has, and so you have to be careful. But it's interesting that she went ahead and had the nerve block. That is an interesting thing. And I have a referral. I use a guy who Dr. Kaska knows very well, and he's helped our patients considerably with the nerve block. And again, you can see I use conventional as well as.
Yes.
But in addition to that, I would definitely want to use some of the hydration therapies to help this nice lady and her mom.
We are coming up shortly on a break, but we'll get started with this.
Go ahead, John.
You come up with optimizing the body's terrain.
Yeah, well, the terrain. The terrain is the state of the inner environment. You know about terrain and soil and things like this. Well, I'm talking about the terrain inside our body. Our things that affect that are nutritional status, environmental issues, exposures, microbiome, immune function. These are the things that disrupt some of the communication in our bodies, and that's what I'm talking about, cellular communication, and how do natural substances help that. And what I'm saying is, if we optimize the body's terrain and we review some of the nutraceuticals that can help that along the way, what can happen is we can help a patient through many chronic conditions, autoimmune, pain, cancer, and we have. But each one of these biologics, when I'm using the term, I'm talking about natural biologics, not manufactured biologicals like we're using in immunotherapy. But I'm saying we can help a patient with these kinds of challenges, system to system, and help them maintain a good quality of life. That's the benefit. That's the benefit of using natural substances to help the body's terrain, get it back to balance. What do I always talk about? Goldilocks. And again, I'm going to tell you that nutraceuticals, natural substances, have the ability to do this. Vitamins, minerals, other types of nutrients. And another thing, John, I want to say in this segment, don't think that nutraceuticals are food. You know, your food is one issue, right? You need to have good quality food. But when I'm talking about nutraceuticals, I'm talking about, again, the constituents in these natural products, using them as a therapeutic substance.
And with that, we're going to take our final break of the morning. 855-839-1210 is our number here in the studio, 855-839-1210. Our show is Health Watch every Sunday, 8 till 9. You're on Talk Radio 1210 WPHD. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Again, 855-839-1210 is the number. We are coming back with more of today's edition of Health Watch after these words. We are back here on Health Watch, and again, operators standing by at Innovative Medical Associates, 856-489-0505. That's the number, 856-489-0505. And just because we go off the air at 9 o'clock doesn't mean they're going off the air. They're there all day. 856-489-0505. You can call anytime, and they will pick up the phone and talk to you. Schedule that initial consultation with Dr. Molly. It is complimentary, 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Our show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We're going to talk to Leslie in South Philadelphia. Leslie, good morning. You're on with Dr. Molly on Health Watch.
Hi, Leslie. Hi.
Yeah, hi. How you doing? I have a few questions because I've been reading about the negative, tongue bacteria and affecting the metabolism of nitric oxide, which is the nitric oxide is really good for the vasculature, and also mouthwash has negative effects on nitric oxide metabolism.
Yeah.
And then I'm wondering, maybe one more to add to the picture. I checked out online, fluoridation affecting autism. I'm wondering if it's through the tongue bacteria and the microbiome and all that.
The microbiome, is very important, absolutely, right? Because trillions of stuff live in us and on us, right? And mostly in the gut. So you're on it, and I think that there's been a lot of research. I know people are talking about the fluoride. That seems to be very, very hot right now. I think it can be one of the contributing factors. I mean, I don't know if it's the only one to autism, but it's certainly worth looking at and maybe spending a few more dollars in research to look at it, in particular, maybe enlarge the groups. As far as the tongue and the bacteria on the tongue, obviously, mouthwash has alcohol lots of times, even the ones without the alcohol. I mean, here's our problem. In the old days, we just had this discussion. I was out to dinner with somebody who said she believed the fluoride in her water, or the lack of fluoride in her water, caused her to have more challenges with bones, etc. I actually seem to think it was different because 55 years ago or so, we didn't have fluoride in the water, and people seemed to do okay. But I mean, the jury's out. If you're asking me conventionally, can that be a problem? I would say the conventionalists will tell you you're crazy. Do I believe that we should look into it? Yes. Do I believe some people have a reaction to the fluoride? Yes. Can they get inflammation from it? Yes. And do I believe inflammation is the cause of all our problems? Yes. So that's the short answer that I can say on the radio right now. Call my office. Come in and chat. I would love to talk to you about it. It's a pretty interesting concept.
Okay.
Thanks, honey.
Thanks.
Okay. Thanks.
Thanks for the call.
Thank you.
Judy in Flowertown. Judy, good morning. You're on Health
Judy.
Watch with Dr. Molly.
Hi, Judy.
Good morning, guys. I just have a quick question. I've been listening to some longevity podcasts, and they're claiming this urolithin A has, I guess, some good aspects for longevity. I was just wondering what your take on it was.
You know, I think here's what I think. I think there's always a new natural product that's coming out with a little more research that says, hey, this can do X amount to prolong your life expectancy. But, you know, I also believe this, and I'm going to say it straight out. I believe that not one single not one single supplement's going to do that for someone. First of all, I still believe all oral supplements we take, we lose somewhere between 30 and 50% of whatever we take in. Okay. Secondly, doesn't that make sense? I mean, which is why, right. So, I mean, I know some of these things become crazy expensive, and my question is, in the end, what do we really need to look at? We need to look at the body's terrain, right? Terrain in general, right? We know that you need antioxidants. We know we need certain good immune-enhancing nutraceuticals, which this new product does from what I'm reading. But also, we've got to continue to reduce inflammation. The quickest way to have a problem and age quickly is not to live a life that uses good nutrition, a certain amount of exercise. And I don't mean to pump iron and be crazy about it. I mean somebody like me. I'm 76, right? I walk. I try to walk 8 blocks a day. That isn't a whole lot, really, when you think about it. I'm not walking 5 miles or any of that. But we've got to continue to move. We've got to continue to eat fairly well. We've got to watch our weight as much as it's, and it's tough. I'm an Italian girl, hon. It is tough. We've got to limit carbs, right? I mean, really. Yeah. My doc one of my docs is Polish. She goes, you think you got it bad. You ought to see how we eat. I said, I know. And these are the things that are going to really promote longevity. And of course, we have to have some genetic component on here. Just because our grandmom and grandpop lived to 102, they lived a different life than we did, right? They weren't as sedentary, that kind of thing. Let's be realistic. I'm one of these that knows. I don't bash any natural products, but what I will tell you is Dr. Molly looks at each of these and says, I don't know anybody that can take more than a few in a day and do it well and continuously. Believe me, it's hard. It's hard, honey.
Thank
Judy,
you.
I hope that answered a little bit of the question.
Thank you for the call.
I love that question, though. I love that question.
Yeah.
Dr. Molly, do you ever do any speaking engagements or in the area?
I'm sorry.
Do you do any speaking
engagement?
I would love to. If anybody wants me to speak at something, I just came back from a couple of conferences to other colleagues that, they either take it or they don't. Most times they boo me, but it's okay. I know. Listen, I got 28 years of showing people's data, and I got to tell you, I want to say this. If you come in on a Tuesday, you're going to see John there. We don't lie.
Yes.
All right? God bless you. God bless
Thanks
you.
for the call, Judy.
God bless, Judy.
And believe it or not,
Our
we're out of
time's
time.
up. Yeah, I really loved Judy's question
Yes.
today. It was great. And so was the other question. It was good.
That is going to put the wraps on another edition of Health Watch. Don't forget, operators standing by right now at Innovative Medical Associates, 856-489-0505. That's the number. and they will be there well after we leave you at 9 o'clock. In fact, they'll be there all day. 856-489-0505 is the number. The website, innovativemedicalassociates.com. innovativemedicalassociates.com, the website. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and of course our nursing staff, Lana, Donna, Jess, Jim, and Daniel, and there's Joanne, Delightful D, Fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thanks for listening. We will do it all over again next Sunday, Health Watch, 8 till 9, here on Talk Radio 1210 WPHT.
All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.